Welcome to another episode of Daktari Explains, keeping it as basic as possible. My name's Cynthia Njogu and I'm a medical doctor by profession. If you missed any of my previous videos, be sure to subscribe to my YouTube channel, Daktari Explains, Instagram, Daktari Explains, and follow me on my Facebook page, Daktari Explains. So what is Daktari explaining today? So today we are tackling correct information. Why should you be informed? And more importantly, why should you be correctly informed about your health? Now, I will start by saying this intentionally. There is no single disease or condition that you cannot overcome with the right information. I repeat, there is no single disease or condition that you cannot overcome with the right information. Because what is information? Information is what you take in, and then there's a formation out of it. As we say, knowledge is power. So that which is formed in you is the power or the driving force that will drive most of the activities you're going to do as you seek your help, as you walk down your health journey. And that's why it becomes very important that you get it right. Now, 2 years ago, I conducted a research on factors that contribute to patient satisfaction with perioperative services in one of our facilities. As I did my literature review, this is where you interact with other researchers' work in that particular field and dimension. So as I went through what others have done, one thing cut across the board, and it was in keeping with my findings: knowledge, knowledge, knowledge. The more knowledgeable, the more knowledge a patient has received from their doctor, the more satisfied they are. The less they receive, the less satisfied they are. On that note, I will say, more often than not, it will be you, the patient, to ask the doctor. Now, you need to know what you need to know, because in most settings you realize patient-doctor contact time is limited. It's limited because there are many patients outside waiting. Maybe the queue is long based on which facility you go to, but often it has to come from you asking, and that's why you need to be powered to know what you need to ask. The other important aspect of being correctly informed is because it allows for partnership between you and your doctor. Now, doctor-patient relationship was never designed to be a superior, inferior person's kind of relationship. It's supposed to be an equal partnership because you all have one goal: to kick out the enemy. Take, for instance, in infections. Infections are simply microorganisms that should not inhabit the body, but now they do. Or they're supposed to inhabit a particular part of the body, what we call normal flora of that area, but now they've gone to a different part of the body, and now they've become an infection in that area. Now, you and the doctor work together with the correct information, because correct information allows for what? Correct prescriptions, correct investigations and all that. And this, you having this correct information also allows you to go home and follow that prescription the doctor has given you to the letter, as you both have one goal: to kick out this enemy. Even in conditions like cancer, where you have cells, which is, we all have cells which become tissues, organs, and now the whole body. But now for cancer, it's this cell, an abnormality happens. So now this, you have an abnormal proliferation of cells. Now what gives us the growth of the tumor or the cancer. Now, with the correct information, you and your doctor work together to attack this enemy who's just come and inhabited your body, and should not be the case. So this is why correct information becomes very important. Otherwise, you'll be told to do this, you'll be told by your doctor to do A, B, C, D, and you're going to do E, F, G, H. And that makes the gap bigger and bigger, and the results become more devastating over time. The other aspect I would want to cover on information is correct channeling of resources. A lot of money is spent moving from one doctor to another, moving from one healthcare facility to another. And if you look keenly, you find that the core problem, the reason you, the patient, are so frustrated and you're moving from one to another is because of a deficiency in knowledge that you did not acquire or that was not given to you. And now this creates a turmoil and now a series of events trying to look for what will work, but in actual sense, you're just looking for a doctor who will give you that information. And that is why in this platform, the goal is to power you. The goal is to give you, to tell you what you need to know, what you need to ask, how to approach certain situations as pertains to health. So be sure to like, subscribe, follow, tell your friends, keep those questions coming. Let me know how I can help you as well. Like I said in my previous video, help the doctor help you. In this platform as well, help me help you, that I may be able to know areas of deficiencies that need to be covered and how they can be approached. And the main goal is to make your health journey as simple as it can possibly be. Remember, there is no condition or disease that cannot be overcome with the right information. Let me know where you've been watching me from. And that's it for today. Looking forward to hear from you in our next video, as we'll be covering who are the people who are found in a hospital setting, because not every white coat is a doctor. And this is information that is important to you, because you need to know who exactly am I dealing with at any particular one time. So yes, enjoy your time from wherever it is you're watching me from. It's goodbye for today.